art and science, creativity and passion, beauty and anatomy. Where most see a face, I see a canvas. This season, the spotlight is on artistry, the intersection of form and function, harmony and healing. Every facelift, rhinoplasty, and every transformation begins with an artist's eye and a surgeon's skill. Go behind the curtain, into the consultation room, the operating room, and the recovery journey. Witness real patients reclaim confidence and discover how beauty just isn't restored, it's reimagined. Because when medicine meets the soul of an artist, the results go beyond the surface. Every artist has a specific style, right? Picasso or Leonardo. Everyone brings their own little nuance to the table. For facial plastic surgery, that's a very interesting concept because good work in a lot of ways is invisible. And so if you know an artist for his cubism or his realism or whatever it might be, that his technique, you're looking at something that makes that person distinct and different. In a lot of ways, when I have done something awesome, when I really feel like I've understood the assignment and executed, you don't know that I was there. The scars are almost invisible. The person just looks natural. They look like themselves or better versions of themselves, but refreshed. And so the concept there is that I almost don't want you to know that I was there, right? It's almost like understanding the physics of a wave, right? We all have swam, we've all been in water, but there's a physics that governs that water. I want my work to almost be that invisible truth that's there, where it's just on its own, standalone, beautiful. And so I don't want you to know that Dr. Truesdale's work was work unless the person wants to share it, in which case, scream it from the rooftops. But I want the person to just look like the best versions of themselves. Okay, so our next canvas, beautiful woman named Devorn. Now, Devorn has an interesting story because she's had some work done before. She's had a brow lift before. And unfortunately, the work that she's had done before did not go perfectly smooth. Couple things happened. Now, she's had surgery in Korea. She had a V-line surgery in Korea. That's where they actually shaved down the bone to create a little bit more of a V-line taper of the jawbone. Now, sometimes what happens is that reduction of structure causes the tissue to fall because the bone is holding everything up. So she's coming to me for a facial rejuvenation. The other unfortunate circumstance is that she had a paralyzed forehead on her right side after her previous brow lift. Now, what that has done is caused asymmetry between her left and her right eye and the brow. And so I'm going to help correct that asymmetry today. Now, before, she had a very famous plastic surgeon here in LA do that revision surgery for her, but unfortunately, it did not go as well. So I've got to build some trust, and I'm super thankful she's willing to give this a go again. We've got our work cut out for us, but let's see what she really wants. Hello.
Hi.
Welcome back to the office. Let's talk about our plan.
Okay. My name is Devon Ville, and I'm from Visalia, California. I heard about Dr. Truesdale from my lymphatic massage lady, so I thought I'd check him out.
Okay. Welcome back to the office.
Hi.
So last time we were here, we got to know each other a little bit. You told me what some of your concerns are.
Yeah.
We did a little bit of dissolving of some filler. Mm-hmm. Let's just summarize everything so far. So you've had a complicated go of things.
Yeah.
Tell me what bothers you, and we'll talk about what we're going to do to help you.
Okay. So, Dr. Truesdale, I hope you will be able to fix this because now my face is like sagging. Mm-hmm. You see this deep here? Mm-hmm. This really bothers me, and then it's like, and there's
the extra stuff down here.
Extra stuff down here, and I just look like I'm bodged. So with the facelift, Is it just gonna be lifting up like this? Is it gonna smooth this out?
Yes, let's talk about everything.
Last year, I went to Korea to have a plastic surgery, and I did a V-line. I did my upper eye, lower eye. How you say, blood plastery? Yeah. So, and now that it healed and my face is sagging and it's extra skin, and the doctor from Korea said, you need a neck lift a year from now. I don't want to fly back to Korea. It's too far. So I go, you know what? I'm going to do it here in the USA. So if anything happen, I can always just drive down to Beverly Hills. And Dr. Truesdale seems to be the best doctor that I've researched so far.
So you previously had that V-line surgery, right, in
V-line.
Korea? So when they reduce the bone, actually, there's less substance holding everything up.
Yeah.
So you need a lift now. So we're going to, because of that V-line surgery, look in the mirror for me. We're going to tighten up all of this looseness here in the neck. In your case, I might need to actually trim a little bit of your submandibular gland down here. So you feel this little walnut structure. So that is going to allow us to get a jawline that's like
Defined,
this.
huh?
Yeah,
Defined
super
like this.
defined. Exactly.
Okay.
Now, in addition to lifting the neck, we're going to lift your face.
Yeah.
Right? So, yes, all of the looseness that's there in terms of the fold is going to come out.
I can't stand the fold.
I got you.
Okay.
We're also going to remove a little bit of the fullness here, right? Because it's a little chubby in this area, the buccal fat.
Okay.
So we're going to take some buccal fat out into this area, right?
Yeah.
We're also going to do a lip lift, correct?
Yeah.
So we started, and it did work. Your lips do look different.
Okay.
Before, there was this extra rim here. Doesn't look so full now. So when you open your mouth, right, there's no tooth shed. We want a little bit. So we're going to do a subtle lip lift to just make things really pretty. It's just going to look really pretty.
Okay.
See that difference?
So I do not need to do my yearly lip filler?
You won't need to do lip filler anymore.
Oh, good.
You won't need to. It's going to be your own lip.
Own lip.
Yeah, so the part that's hidden on the inside, look in the mirror. All that on the under is going to be now showing. So it's going to look like it has more volume. See how this side looks prettier? It's going to look really nice. Now, when I met her for a consultation, I can see she's nervous, right? She's been through a lot. This is not her first go-round in plastic surgery. Sometimes people come to me with trauma, right? Surgery is trauma, but sometimes that trauma runs deeper. It's psychological. Because when you've had issues with surgery, right, sometimes the answer is really more surgery. So I'm gonna get it right for her this time. Let's go.
Hello. I'm great.
You're here to see Dr. Truesdale?
I'm here to see Dr. Truesdale.
Oh, great. Girl, did he talk to you about that one post? I think it was on Instagram that they were using your pictures. Did he talk to you about that?
No.
Let me show you. They're using your photos as facelift results. We don't know who that doctor is.
Oh my God.
Like talking in front of it, saying that it's his results.
My God, Mom, what is he talking about? So now I have children over in where? Vietnam?
I don't know. They're using, and look at, he even put his watermark over it, which is like,
goodness.
that just, now we have to start doing that. Now we have to start showing Dr. Truesdale in all of his videos because they're taking all of his work.
Wow.
It happened for this one, and it happened to for Christine. Remember she was in Beyond the Surface episode 1? Yeah. They did that for her
Well,
too.
you know they say the greatest form of flattery is imitation, but I mean, my God, she's still in my son. My son is, they're still in my son's mother. And I'm all the way in Vietnam. Wow. Crazy.
Isn't that crazy?
Well, they said it was going around the world. I mean, he's global anyway, but so here it is now, people stealing his stuff.
If we want to make this side look more like this side, what I can do is I can actually reshape this side with a little bit of volume, right? Because if you look here, the two cheeks are slightly different. If we want to do that, we can talk about that. That would be taking fat from another part of your body and injecting it in. I would rather just lift your face and add a bunch of volume because you have a larger face, you know, a fuller face already. I don't want to make you look any more less defined. I want to sculpt you.
Okay.
So I think that's why we didn't choose to do that. I think a little bit of asymmetry, we're just going to have to. It's going to be okay.
Deal with it,
It's cute. If it was massively off, I would say let's do something about it.
Just a little bit.
Yeah, just a little bit.
But with the buccal fat, it would be an improvement?
It's going to be different, right? Because the buccal fat is this part down here. It's not so much this up here. Where if you look, the part of your face that's very, very different is up here. See that the two cheeks up here? Your maxilla and zygomatic bone. So it's going to look more similar because when everything comes up, right, you're going to have more of that V shape, right? That contour. But it's not going to be exactly the same.
Coming back from Korea, I wasn't really happy with the result because I think with eye surgery, even the doctor here, here in Beverly Hills, he told me that with eye surgery, you need to do it here because sometimes it might be a revision because you have to, because you're a little bit awake when you do your eye surgery. You have to close your eye, open your eye, and then, so sometimes they don't take out enough skin. So it might need a revision, you know. So, yeah, if I known that, I wouldn't have not flew to Korea.
So for Devorn, we're going to do several procedures. We're going to do an endoscopic brow lift, revision, a earlobe reduction, a face and neck lift, an revision upper blepharoplasty, a lip lift, and buccal fat removal. Who knew we would be here, right?
Well, you know what? I kind of think that Uncle Charles knew because he used to always call me Miss Hollywood. So somebody knew something that was going to be happening, but I had no clue.
Well, this was definitely, a far cry from River Road, upstate New York.
Upstate New York.
So cornfields to get to the house, and now we're on Rodeo Drive, literally with my office with 5,000 plus square feet, looking for more office space, 20 employees. It's wild. It's a blessing.
It's a true blessing. And when you think about, for me, going from Jones Court in Elmira, New York, housing project, to homeless and in Detroit to Rodeo Drive.
Right.
It's an amazing journey.
You've had a crazy journey.
Yes, I have.
Correction officer, single mom, 3 kids.
Construction worker.
Yeah, factory worker.
Yeah.
And now look at you.
I know.
Pink suit on Rodeo.
Yes.
I mean, it's literally like Pretty Woman, but like the real Pretty Woman.
This is a real Pretty Woman.
Are you the real Pretty Woman?
I'm the real Pretty Woman, okay. Miss Hollywood.
A surgical scissor and a DeBakey. A DeBakey is an extension surgically of my own hands. And so a lot of times I'm using these to grasp tissue to control what is happening with the art. It's not just a tool, it's an extension of my own hands. The surgical scissor. This is a facelift scissor. And as I use one hand to grasp, I use another hand to cut. And this allows me to have large paint brush strokes or fine nuance paint brush strokes. Depends on what I'm trying to do. It allows me to dissect, to free the underlying structure so that I can manipulate it. I am shaping, I am contouring with my scissor. I am removing excess with my scissor. So it is literally the most common instrument that I use. These two instruments together are typically an extension of my hands. So Devorn is coming back today. She is about 2 months after surgery, and I am super excited to see how amazing she looks. Devorn, welcome back.
Hi.
Good to see you. So, welcome back to the office. I want to start off by just showing you. Look at this.
I know.
Look at your neck.
Yeah.
The jowl.
Yeah. Oh yeah. Wow.
Your eyes, look at your eyes.
Yeah.
And the lip. Still working through the scar, but the shape, absolutely beautiful. Look at that shadow that's happening underneath your neck there.
Yeah. Oh, I know. Oh.
Look at that.
Yeah.
That is
amazing. Yeah.
Crazy.
I know.
So you're a month and a half?
2.
2 months. Okay. So let me look at you. Close your eyes for me. Beautiful. Good. These scars look amazing. And that was a revision eyes, right? Yes. And open.
I was just like, wow, I can't believe I went through, this whole procedure with Dr. Truesdale. Feels like a dream, but it's something that I'm really happy with, and can't believe it happened, and it went really well.
They were complicated because you had it done before.
Yeah, 2 times.
2 times.
This is the
you
third
finally
time.
got it right.
Third time.
Third time's the charm.
Yes.
And then the lip. So right now it's a little thick, especially on this side. This side looks perfect. The shape is amazing. What we're gonna do is we're gonna do another steroid injection. It's gonna just get it to flatten out. If that doesn't get us where we fully want, I can always cut it out again, and then we'll do something different. We'll radiate it. But I think with where you look right now, I think if a little bit more time, just to get it to flatten out, then we won't be able to see it. But right now it's super fine. But the lip shape, do you love it?
I love it.
Good.
Yeah.
And then this
Just
neck.
looks natural.
Yes, natural.
Nice, natural.
This jawline, my dear, you could cut glass. Has anyone noticed?
Yes, I go to places like, you look nice, you look younger.
Where do you go?
I went to the Lao New Year.
Okay.
Lao New Year in the temple. And then, you look younger. Did you do something? I go, I had a little bit of help.
Wow, she looks literally like a child. Her face is so lifted, but it's natural, right? She looks super sculpted. Her jawline is insane. Her lip looks beautiful. Her eyes are finally symmetric, right? All of that finesse work by lifting one brow a little bit higher than the other one, removing a little bit more skin on this eyelid than the other side, right? It all came together and her lip looks beautiful. Now, she's Asian, and like black skin, Asian skin sometimes can form keloids. Now, she's got a couple little areas underneath her lip, around her ear, that are a little hypertrophic. That means that the scar is starting to produce a little bit too much collagen. Now, before this gets out of hand, we are going to inject her with some steroid. That should get that area to flatten out.
Before that, I was just not happy with the way my face looks, and I was just like, oh, I really need to find the right surgeon to correct this problem. So, just fast forward, looking Dr. Truesdale up, came for consultation, booked an appointment, so everything just happened so fast. That's why usually people take like years, months to look up a doctor, but with me, I just look him up, and less than a month, I just decide to, you know what? His results are really great, so I'm not gonna keep looking.
I can't remember how old you are or how young you are.
I'm gonna be 52.
Oh my gosh.
In June.
Yes, definitely would not think that if I saw you on the street. And this is my job.
Yeah, it's your job.
Let me look on this side.
You did a wonderful job.
Thank you. You're, who did you bring with you? Your sister?
Last time my sister.
Yeah, your sister. Your sister-in-law. What did she think of the whole process?
Oh, well, when she saw me, going back to the hotel, she's like, oh my goodness, you look scary. You look painful.
She seemed like she was a little nervous with surgery.
Yeah.
But now, have you seen her since, like, you've been healing? Okay. Good.
Oh, it feels good. I don't hide the fact that I had plastic surgery. I'm not like, I did like lip Botox. I go, no, I'm really happy. I had plastic surgery, I had facelift, and I'm an expert. So if you guys need to have any question, come to me. I'm an expert. So I told them I'm happy to educate people about it. Oh yeah, like a couple of weeks after the surgery, I look in the mirror. I'm like, wow, I actually I had I had full facelift, neck lift. I look at myself and I'm like, this really looks good, and I can't believe that I did it, but it's the best decision of my life.